Imagine, like, that stepping off this luxury cruise ship, right?
Yeah.
You're in the sunny Canary Islands.
Sounds pretty ideal, honestly.
Right. You've got your luggage. You are super ready to just head to the airport. But instead of the usual row of shuttle buses, you are met by this literal wall of international health officials.
Yeah, and they're in full, like, head-to-toe biohazard suits.
Exactly. Hazmat suits. And I know, as a listener, you were probably hearing cruise ship and virus and instantly having flashbacks to the early days of 2020.
Oh, absolutely. The imagery it's incredibly triggering for a lot of people.
It really is. But the culprit causing this specific lockdown, it is not a resurgence of COVID-19. It's actually this highly lethal pathogen that's normally found in the dust of South American mouse droppings.
Which is just wildly out of context for a cruise ship.
Right. And somehow, defying almost everything we know about how this virus operates, it is spreading from passenger to passenger on the high seas.
Yeah, it's like a locked door mystery, but, with virology.
Exactly. And that is exactly what we are getting into on today's deep dive. Our mission today is to just unpack exactly what is happening on this ship, why health officials are treating it so uniquely, and most importantly, what it actually means for your safety.
Right. We really want to cut through those scary headlines and just deliver the facts. Because, the situation unfolding right now on the MV Hondius, which just docked in Tenerife on May 10th, it is serious. We're looking at a localized, deadly outbreak of hantavirus.
Which sounds terrifying.
It does. But synthesizing the data from the World Health Organization, it really paints a fundamentally different picture than those hazmat suit images suggest.
Okay. How so?
Well, the WHO Director General, Tedros Adhanom Ghebreyesus, he's explicitly categorizing the global public risk as low. He's saying there's no reason to panic.
I mean, I hear you, and I hear the WHO, but that feels wildly counterintuitive.
I know.
You hear cruise ship outbreak, and you see passengers being escorted off in protective gear, spaced out in small groups.
It looks like a movie.
It does. It feels exactly like 2020. So, I mean, how can Dr. Boris Pavlin, the WHO guy handling this, be so confident when he says, this is not COVID?
Right. To understand that confidence, we really have to look at the timeline first, because it shows a very slow-moving, isolated event, not like an explosive contagion.
Okay, let's map it out, because I'm looking at the ship's manifest, and this journey didn't just start.
No, it's been going on for a while.
Yeah, they departed from Ushuaia, Argentina, way back on April 1st.
Right.
With about 150 passengers and crew. So how does an outbreak stay hidden for over a month before they even reach Spain?
Well, it's a geographically long route, and it's isolated. So they leave Argentina April 1st. 2 weeks go by, and on April 15th, they stop at Tristan da Cunha.
Okay.
Then by April 24th, they reach St. Helena, and this is an important detail. 30 passengers actually disembarked there and headed home.
Wait, 30 people left the ship before anyone even knew what was happening?
Exactly. It wasn't until they arrived in the Canary Islands on May 10th that the port authorities, recognized the full scale of the crisis.
Wow.
But the medical timeline is much earlier. The virus was active way before Spain. The very first fatality actually happened at sea on April 11th.
Oh, wow. So they were dealing with this on board for almost a month.
Yeah. And by the time they docked in Tenerife, the WHO had identified 8 confirmed or suspected cases.
And the human toll here, we have to acknowledge, is heavy.
It's awful.
3 deaths total so far. The sources mention a married couple and a German national.
Right. It's a deeply tragic situation for those families.
Absolutely. But, okay, this brings me back to my main pushback here. You've got 3 fatalities. You've got officials in full PPE on the docks.
Yeah.
If the WHO is so confident that this isn't COVID, why are they using the exact same extreme visual countermeasures?
I get why it looks contradictory, but it really comes down to the fundamental mechanism of how the virus spreads.
Okay.
So think back to the engine of the COVID pandemic. It was asymptomatic spread.
Right, people looking fine but infecting everyone.
Exactly. You could be shedding massive viral loads while looking and feeling perfectly healthy. It effectively turned everyday interactions into this, silent lottery.
You just never knew who the threat was.
Right. And that is what traumatized the global health infrastructure. But with this hantavirus outbreak on the Hondius, authorities have absolutely no reason to believe asymptomatic spread is occurring.
Wait, really? None at all?
None. And that entirely changes the epidemiological math.
How so?
Well, when a virus only transmits through close contact with someone who is actively displaying symptoms, containment is actually incredibly straightforward.
Okay, I think I'm tracking.
So those hazmat suits and the strict spacing in Tenerife, they aren't desperate measures against some invisible threat. They are just highly effective barriers against a known observable pathogen.
Ah, got it.
Because nobody currently leaving that ship is showing symptoms, they aren't silently infecting the port workers. Active isolation works perfectly in this scenario.
Okay, so because the virus basically announces itself before it becomes highly contagious, we can actually see the enemy coming.
Exactly.
That makes a lot of sense. But it raises a massive question about the virus itself, because the sources specify this is the Andes strain of hantavirus.
Yes, the Andes strain.
And normally, like we mentioned, you catch hantavirus from rodents, you're sweeping out a dusty shed, you inhale aerosolized mouse droppings.
Right, that's an environmental exposure.
So how on earth are humans contracting a rodent-borne illness from each other on a boat in the middle of the ocean?
It's because the Andes strain is this extreme outlier in the hantavirus family.
Like a mutant.
Yeah, through a specific genetic mutation, it's literally the only type of hantavirus known to be capable of jumping the human-to-human gap.
Wait, the only one in the entire viral family?
The only one. Typically, yeah, you need that rodent vector. But the Andes strain, which, by the way, is endemic to specific rodent populations in South America.
Which matches the ship's departure point in Argentina.
Exactly. It bypasses the need for the rodent once that first human gets infected.
Wow.
And it's also crucial to note for our listeners, the CDC confirmed that these specific rodents carrying the Andes strain, they do not even live in the U.S.
Okay, well, that definitely isolates the environmental risk for people at home. But the physiological risk to these passengers is terrifying.
It's incredibly severe.
Because the clinical description in the reports, it cites hantavirus pulmonary syndrome, or HPS.
Right.
What is a pulmonary syndrome actually doing inside the body to cause such rapid respiratory failure?
The mechanism of HPS is just devastating. The virus doesn't just attack your lung tissue, it actually targets your endothelial cells.
Okay, what are endothelial cells?
They are the cells that line the incredibly tiny blood vessels, the capillaries, inside your lungs.
So like the plumbing system that exchanges the oxygen.
Precisely. It infects that lining, and then your body's immune system, it recognizes the invasion and launches this massive counterattack. And this immune response causes intense inflammation, which damages the tight junctions between those endothelial cells. So suddenly, those capillaries lose their structural integrity.
Oh, wow. So instead of acting like a solid pipe carrying blood, the capillaries turn into something like, I don't know, a soaker hose in a garden, just leaking fluid everywhere.
That is exactly what happens. The medical term is pulmonary edema. Fluid just leaks out of the bloodstream and completely floods the tiny air sacs in the lungs.
That sounds horrific.
It is. The patient isn't suffocating because their lung tissue is destroyed. They're essentially drowning in their own plasma because their internal plumbing has become permeable.
God. And what makes this even more insidious, according to the sources, is the incubation period.
Yes. The window is huge.
It can take anywhere from 4 to 42 days for symptoms to appear after exposure. I mean, that is a massive window. It's essentially a slow-burning fuse.
It is, and the initial presentation really acts like a smokescreen.
How do you mean?
Well, for the first 4 to 10 days of illness, the symptoms are incredibly generic. Fever, chills, profound fatigue, maybe some diarrhea.
So if you are on a cruise ship, you might easily dismiss that as like a mild stomach bug from the buffet, or just standard travel fatigue.
Exactly. You'd think nothing of it. But the fuse is still burning, and when the virus finally breaches those endothelial cells, the progression is shockingly fast.
Like how fast?
A patient can go from a slight fever and a mild cough to acute respiratory failure requiring a ventilator in a matter of hours.
Hours.
Yeah. It's a Trojan horse, it opens, and the localized flooding of the lungs begins.
Okay, but a 42-day fuse, that completely redefines the scale of containment.
It really does.
Think about the timeline we just established. If someone was exposed on day 2 of the cruise, they could disembark, fly home, go back to work, and not feel a single symptom for over a month.
Right.
How does the global health infrastructure even begin to track that?
Yeah.
Especially for the Americans who are returning home right now.
It requires shifting from, passive observation to highly aggressive active monitoring.
What does that look like?
The WHO protocol dictates that anyone exposed to a confirmed case has to be monitored daily for exactly 42 days after their last potential exposure.
So you can just test them and let them go.
No, absolutely not. You can't just administer a test, see a negative result, and send them on their way. The virus could still be incubating on day 40.
Wow. Which completely explains the intense logistical operation happening in the United States right now.
Exactly.
So the first group of Spaniards flew back to Madrid, but the 17 remaining Americans from the ship, they're being flown directly to the National Quarantine Unit at the University of Nebraska Medical Center.
Yes, the UNMSC.
What makes that specific facility so necessary for a group of people who aren't even showing any symptoms yet?
Well, the University of Nebraska Medical Center is essentially the gold standard for biocontainment.
Okay.
This isn't just like a separate wing of a normal hospital. It is a specialized fortress designed to protect both the patient and the outside world.
Wait, I think the CEO had a quote about this, right?
Yeah, Dr. Michael Ash. He noted that their teams have trained for decades with federal partners for this exact scenario.
So what does a specialized biocontainment fortress actually look like? Like, how is it different from a standard ICU?
The engineering is just entirely focused on isolation.
Okay.
For instance, the unit operates under negative air pressure. That means air flows into the patient rooms, but it never, ever flows out into the hallways.
Oh, that makes sense.
And all the air exhausted from the unit passes through these heavy-duty HEPA filtration systems that scrub out biological contaminants.
Wow.
They even have dedicated autoclaves to sterilize medical waste before it ever leaves the floor. And the staff undergo rigorous, methodical decontamination protocols just to take their protective gear off.
So taking asymptomatic people there guarantees that if that 42-day fuse reaches its end, the crisis happens inside a sealed environment.
Exactly, a heavily armed, sealed environment.
But, and this is a big but, the Nebraska facility only accounts for the 17 Americans who stayed on the ship until Tenerife.
Right, the ones who went the whole way.
We have to look back at that stop in St. Helena on April 24th.
Ah, yes.
30 passengers disembarked there. And some of those were U.S. nationals who traveled home before this outbreak was even recognized by the WHO.
Right, they were just traveling commercially.
And the CDC confirms they are actively monitoring people across multiple states now, Texas, Georgia, Arizona, Virginia, and California.
Yes, they are.
And this is where I have to ask the really difficult question. Because the CDC released a statement on May 7th claiming the risk to the American public is extremely low.
That's correct.
But the New Jersey Department of Health just announced they're monitoring 2 residents who weren't even on the cruise.
Yeah, okay.
They simply took a commercial flight with someone connected to the ship. So if health departments are tracking people down just for sharing airspace on an airplane, how can the CDC claim the risk is low? Doesn't that air travel exposure completely prove the virus is out in the wild?
Look, I get it. It is entirely logical to hear about commercial flight exposure and instantly assume the containment net is leaking.
It sounds like a massive breach of the perimeter.
It does. But epidemiologically speaking, the situation in New Jersey actually proves the containment net is functioning with incredible precision.
Okay, you're going to have to explain that to me.
Sure. We have to differentiate between a broad public threat and targeted proactive contact tracing.
What?
Contact tracing works in concentric circles.
Like a ripple effect.
Exactly. The primary circle is the people actually on the ship. The secondary circle is the people they immediately interacted with on their journey home.
Right.
So the health departments coordinate with airlines, they pull flight manifests, they analyze seating charts, and they look at the ventilation zones on those specific aircraft to identify anyone who even tangentially shared airspace with a passenger from the Hondius.
Wait, they actually map out the airflow of the cabin to find secondary contacts?
Precisely. They get that granular. And the 2 individuals in New Jersey, they are entirely asymptomatic. They are not hospitalized.
Oh, okay.
They are just being monitored out of an extreme abundance of caution. The fact that the New Jersey Department of Health found them before they ever showed a single symptom means health officials are outrunning the virus.
I see.
They're establishing the perimeter far ahead of the actual threat. A breach would be someone walking into a New Jersey emergency room with fluid in their lungs and no known connection to the cruise.
Right, a mystery case.
Exactly. Finding asymptomatic people on a flight manifest. That is the system working perfectly.
So the monitoring isn't proof of failure. It is literal proof of thoroughness.
Exactly. And, the New Jersey Department of Health reiterated that there are 0 current hantavirus cases in the state.
Right.
And historically, there has never been a confirmed case reported in New Jersey, ever. The risk to the general public remains extremely low because those few individuals with potential secondary exposure, they're already identified, they're educated on the symptoms, and they are isolated from the general population.
That historical context is really important, actually, because while this human-to-human Andes strain is super rare, the broader hantavirus family is not entirely foreign to the United States.
No, it's not.
The CDC has been tracking it since a major outbreak in the Southwest back in 1993.
Right.
And through 2023, there have been 890 total cases reported domestically.
Yeah, but the profile of those domestic cases provides a really stark contrast to what we're seeing on the MV Hondius.
How so?
Well, the vast majority of those 890 cases occurred in western and southwestern states. Furthermore, 62% of the individuals who contracted it were men.
Oh, really?
Yeah, and the transmission was overwhelmingly linked to occupational or recreational exposure to rodent habitats.
Right. So we're talking about like cleaning out barns, sweeping dusty sheds, opening up rural cabins after the winter.
Exactly. It's a totally environment-based risk.
And it's a disease that doesn't care about your status either. I mean, the sources mentioned it actually caused the death of Betsy Arakawa, who was the wife of the legendary actor Gene Hackman.
Yes, unfortunately.
But the point is, it is localized.
Yeah.
You don't catch the domestic strains of hantavirus at the grocery store.
No.
And you certainly don't catch them from another person on an airplane.
Right, which is exactly why the Andes strain is such a profound anomaly in virology.
It's the exception to the rule.
Totally. It takes a localized environmental pathogen and suddenly gives it the mechanical ability to move through human networks.
It's wild.
And the collision of this rare human-to-human mutation occurring inside a confined, highly mobile environment like a luxury cruise ship, it is just an extraordinary sequence of events.
So bringing this all together, what does this complex virology and all these global logistics actually mean for you listening to this right now?
That's the main takeaway we need to hit.
Right. We have this deeply tragic outbreak of a rare virus. It's this locked door mystery on the high seas that has very unfortunately claimed 3 lives.
Yes.
But the biology of the virus is actually the key to your safety.
Absolutely. The lack of asymptomatic spread, it just cannot be overstated.
Right.
Because individuals do not silently transmit the virus while feeling healthy, health authorities are not out there fighting a ghost.
They can see it.
Exactly. They can rely on visual screening, temperature checks, and targeted isolation to literally sever the chain of transmission.
Which means the massive quarantine efforts, like securing those remaining Americans inside the negative pressure fortress at the University of Nebraska, they're going to be highly effective.
Highly effective.
So you do not need to cancel your summer travel plans. You do not need to go out and stockpile supplies.
Definitely not.
The experts have a really firm scientific grip on exactly how this pathogen operates, and they have the infrastructure to box it in.
They do. But, as we look at the broader implications of this event, there is one final, almost mathematical reality to consider here.
Okay, what's that?
Think about that 42-day incubation period we talked about. A month and a half.
Right, the slow-burning fuse.
Now, apply that biological fuse to the mechanics of modern aviation.
Oh, wow.
If an individual takes just, say, 2 flights a week for 6 weeks, they're traversing different airports, walking through international terminals, interacting with rideshare drivers and hotel staff.
The exposures just multiply.
Exactly. The number of unique human exposures multiplies exponentially into the tens of thousands well before that person ever develops a single cough.
I mean, the math of tracking that is just staggering.
It is almost incomprehensible. So the real marvel of the MV Hondius story isn't just the genetic anomaly of the Andes strain,
Right.
or its ability to cause capillaries to leak fluid. The true marvel is the invisible global web of epidemiologists and contact tracers who are successfully unraveling that staggering math in real time. They are pulling flight manifests, calculating cabin airflow, and making phone calls across time zones, working relentlessly to essentially outpace